Welcome to All Things AI. My name is Ishan, and in the third episode, we have Ms. Rachini Moosavi, the Chief Analytics Officer of the University of North Carolina Healthcare System. Welcome to the channel, and it's an honor to have you here today.
Thanks for having me, Ishan. Great to be here.
So how's your day going so far?
It's a whirlwind as always, but it's a great day. How
Great
about
to
you?
hear. Oh, yeah, it's going good. Pretty busy. School starts tomorrow, but yeah, so just getting
Wow.
everything.
Yep, my kids start next week. I understand that.
So moving into the first part of today's interview, I want to talk about UNC's integration, UNC Health's integration of AI into their system. So on a broader scale, how does UNC plan to incorporate AI into its healthcare system in the future?
Yeah, that's a great question. I think healthcare is really at a pivot point when it comes to its adoption of technology, especially technology like AI, into the different tools and capabilities that it has. Um, we are one of those health systems, like many, that are saying there's an opportunity here. There's things that we should be exploring, things that we should be a part of. One of the ways that UNC Health is doing that is by trying to be a leader in that space. We don't want to wait and see. We want to be at the table, testing things out, seeing what works. When it comes to technology like AI, it's not a given that it's going to have the best results. So we need to be able to get our experts, our clinicians, our folks in the operation space engaged to make sure that we can test out those capabilities.
And so has there been any progress on that? In the
Yeah. Yeah, so we've had our own data science shop since about 2016, and those folks have been churning out AI capabilities for our healthcare system since that point. So this latest generative AI conversation is newer to to adoption in healthcare. It's definitely not new at all, but in the space of data and analytics and healthcare even. I mean, we've been doing some of these capabilities, but the availability of it, the broadness of it, the fact that it's being integrated into technology that a lot of our health systems own is probably the newer part of it. We've really been taking advantage of things like developing sepsis prediction models, trying to do things like case duration for the ORs in terms of what is the accuracy of those case durations. But the conversation is shifting now towards the generative AI and when and where and how we can adopt that into the technologies that all of our staff, our teammates use.
I think, yeah, generative AI just speaks of how powerful like LLMs are is going to be possibly like the future of where medical AI goes.
Absolutely. It definitely has a really big piece in this pivot point from AI being something that's incremental improvements to being transformational improvements.
So next, you were earlier talking about how AI can, or how UNC is moving forward. They don't just want to wait and watch exactly how other institutions incorporate AI. So do you think this exactly is going to help UNC set themselves apart from competing institutions?
I think being an early adopter of AI it's still yet to be seen, right? Like, let me put it that way. I think the reality is that UNC Health has always been an innovative organization. We have great partnerships with our research community and really great partnerships with all of the operational and clinical spaces throughout our healthcare system. And we have a really diversified patient population. So I don't know if you know this, but North Carolina has the second highest rural population of any state behind Texas, right? So it's one of those things where we have our metro areas like in the Raleigh, Durham spaces, but we've also got a really big rural population. I think what could help differentiate UNC Health is how we can apply things like generative AI and large language models to assist our very diversified patient populations, and help our clinicians and care teams with how they perform their tasks towards supporting those patients as well.
And so in this process, has there been any challenge in the incorporation? Because it's obviously hard to get like AI up to speed with exactly how a doctor can diagnose. So what was like, or if there were any challenges in incorporating, what did that look like?
Yeah. Well, I think the first thing to acknowledge when it comes to things like generative AI is that the benefit is not just to clinical diagnosis, right? I think that's where people immediately jump to. But when we think about the entire industry of healthcare, we have everything that a lot of industries have as well. We've got those operational and financial and administrative spaces as well as the clinical spaces. So I think some of the early adoption, so one of the things that UNC Health is doing for the things that we're building ourselves is looking at things that will have a high impact return with lower risk, which often means that we're keeping away from the clinical build side of things and looking to partnerships to assist us with that. So when it comes to the how do our clinicians work, one of the things that UNC Health is engaged with is Epic's part. They've reached out to a few partners. We're one of the 4 or 5 health systems that are engaging and testing out some of their capabilities. And Epic is our electronic health record system, but they're building out some capabilities to help with in-basket messaging and how those responses might come out to how a provider might want to respond to a patient message that comes through. One of the reasons that's so important is since the pandemic, all of us, I mean, if you think about the healthcare that everybody's going through, it turned virtual in nature through the pandemic. And it became so easy to take advantage of I can message my provider in things like my chart to be able to quickly shoot off your questions. So that really made those in-basket messages skyrocket, which adds to the additional efforts and needs that we put on our providers in addition to the face-to-face clinical engagement that we ask of them. So if we can think about that one little narrow segment, which is not little really truly in any nature, but that one segment of in-basket messages and how do we make that easier? It's not about replacing the physician, it's about augmenting what our clinicians can do, right? It's about giving them a draft that they can start with so that they can add their own pieces of clinical expertise to it. And it just makes the process faster and easier for them.
So it's like, I guess, in a way, like a tool for assistance that physicians can use in parallel with obviously their expertise. And then, yeah.
Absolutely. Absolutely. Yeah, there was a really great article that came out, and I'm forgetting which one of the big name news releases it came from, but they actually called it this generative AI phase, the ability for us to create centaur doctors, right? And centaur clinicians, right? So it's not about, again, replacing what the human can do. It's about how we can make them all that much better by augmenting their capabilities. And the centaur piece being the person augmented by the AI.
So next, I want to move into like data privacy because obviously that's a big part when we're developing any LLMs or AI models. So generative AI can play a major role in enhancing, for example, like medical reports, like either it can learn from them, like simulating outcomes, or also speed up the process by like giving a template for doctors to work off example. But there's a major concern that comes up with like the data privacy and breaches, especially with like how data is secured. Like let's say a hacker intercepts the data and then creates a generative AI that's a model that's not necessarily going to work for the patient, but against the patient. That's again a risk that it's hypothetical, but it's definitely possible. So is there a specific risk that generative AI poses to patient privacy?
Yeah, so I will say this at a broad level and try and bring it back down. I think the one thing we have to acknowledge with any kind of electronic transmission of data and information is that there is no such thing as zero risk. Whenever you have any of those electronic formats, it's about mitigating the risk and managing them. It's not about there is no ability to 100% eliminate it, right? So we as a healthcare system and like all industries, our biggest thing is how do we make sure that we keep on top of it as much as possible? How do we evaluate the capabilities? How do we ensure that we know that the pipeline that we've created to do this work for things like generative AI is safe and protected in a way that we can protect our patients and our teammates' information as much as possible, because that is the goal for everybody, right? To make sure that we take care of our people, not just them as a human being, but their electronic data as well.
Yeah, so on that note, I think like one of the things is in data sets, especially ones that are publicly available, patient data is often like taken out. So like the private information, at least so private health information. So could you give us an insight on like I guess even on a high level, like what steps does UNC take to remove patient like or private health information, like let's say when providing data to researchers?
Sure. Yeah. So PHI is a term, it's protected health information. And that's a very, very defined about 18, 19 specific items that we track and we know and classify, I guess is the better term to use, to be able to say these are the most protected elements of the data that we have available to us that we need to take a much higher level of scrutiny in protecting. So when it comes to things like research, for example, there is an entire process that is very complicated and that gets into something called the Institutional Review Board for what those folks that are doing research can and can't do with human subjects, data subjects, whatever the case is, right? So, but when we are talking about cases of where there's data involved, a lot of times, and in a lot of cases, we can use de-identified data sets to get some folks started, which means we remove that PHI from the data. And you can have a third party who helps to scrub that. That's not part of that research team that allows for a safe transmission of appropriate data to the right spaces to be able to take advantage of it. There's also a whole bunch of other organizations that are standing up where data is being fed by other groups, not necessarily UNC Health, but that groups that can come together to help improve the amount of information, the types of information that's being used for clinical research to try and improve just the how and what we do in healthcare in a way that it's protecting the data as well.
Okay, so next I want to move on to just data in general and how hospitals are going to use data because obviously we get the data from the clinic and then that gets transferred to a research institution or independent researchers and then that's how like AI models would be created or at least at a certain level. So hospitals are often like in certain occasions like reluctant to collaborate and share data with one another because it's I guess in this some form of competition but also to see who can get the best model. But then like one of the most important steps in ensuring that a model is well trained and acquainted with real life settings. So if we want AI to be able to diagnose, for example, is to have a wide variety or wide spectrum of data that the model can learn from. So do you think the fact that hospitals sometimes don't collaborate and that there just isn't enough data in general is going to hinder the progress of development for medical AI?
Yeah, I think that's a phenomenal question, and it is something that I think could be one of the barriers might not be the right word for it, but it could be something that slows down progress for the broader availability of data. But I would say that there are lots of different elements to the sharing of data that come into play beyond just the protection of data, right? There's a lot of you have to look at the healthcare industry as something that is completely altruistic in the fact that we are taking care of people and trying to help them get better. But there's also an entire industry that it's making money off of the capabilities that are created, the pharmaceuticals that are created off of it, the technology and the things that other groups are trying to sell. So when it comes to the health systems that own that data, right, there's some degree of what is the best way for a health system to engage in all of those different aspects of the healthcare industry and find the right ways to engage in it, find the right things that are meaningful to the organization for how they want to help advance any given space. Sometimes that could mean that there's a partnership that gets created. So for example, and I'm going to say this in general, you could have a company that's developing technology using computer vision to spot lung nodules. They might build out their capabilities using some limited data sets and then find partnerships with different organizations through contractual arrangements and protection of information and sharing to test out their products in a beta kind of format where it's not being used directly for patient care, but it is being used to understand the efficacy of the product that they've created. Right. Those are all ways in which it's not necessarily that we're directly taking our data from one spot and giving it or moving it somewhere else, but that we are targeting specific ways that within healthcare that you can help develop certain capabilities to address a given problem or a given situation. Now, your question is phenomenal also because in an ideal world, and I'm saying this because it would be lovely if we could do it. There would be readily available data that anyone and everyone could use to try and build these products. But you have to think about that balance. And that's why your questions on data protection are so important, right? You have to think about that while there's a lot of altruism that comes through, there's a lot of benefit for the capabilities that we're creating for people. There's also nefarious actors that are out there, and we have to protect the data and the information that flows for all of that.
Yeah, and I think just to add like an example, I think in Cleveland, where I'm from, there's three major health hospitals. So I think for Case Western Reserve University, which has a partnership with all three, I think what happens is like certain data, like a data set, for example, could be transferred into Case Western, and the researchers there would work from it. Obviously, I don't know exactly what happens on the like inner level, but do you think a partnership like that is something that more institutions in, I guess, cities could incorporate into their system?
Yeah, I think it's happening. I think it's happening at multiple different levels. There's a lot of data protection and contractual arrangements that go around those kind of capabilities and those kind of arrangements to support those types of needs. So I definitely think that that's a great example of where it's in action and it's happening a lot more than maybe that all of us are even aware of in terms of how different groups are coming together to create those kind of opportunities.
So next, I just want to move into today's final portion. So just career advice, branching out of AI. So at this point, you hold a big position at UNC Health, and there's a lot of people looking to climb up the career ladder, and it's in no way easy to do so. So what do you think helped you reach this point?
Yeah, I like to tell people that my career is not necessarily something I sought, it's something that found me. Right. And I say that because I think there's a lot of people who think that you have to know who you're aiming to be at the middle or end of your career on day one. And the reality is that if you had asked me when I was 22 and just getting into healthcare consulting, whether or not I ever thought I'd be the chief analytics officer, I would have said no way. Right. You might have even asked me that 5 years ago. I might have said no way. But I think the reality is that as we grow and develop and get into our careers, keeping the door open for the things that excite us, the things that interest us, the things that we feel like there is a good alignment of values and mission and purpose towards the capabilities that we bring to the table to me, that is the most important thing that you can do in finding your career path, looking for that alignment and making sure that it's something that you want to do every day.
Yeah, and so you were talking about exactly how it wasn't like you would have never envisioned this, even just looking back 5 to 6 years ago.
Mm-hmm.
So in this process, were there any struggles like managing a work-life balance, for example?
Oh, sure, absolutely. I tell my team all the time that the reality is that we are all whole people when we come to work. There is no such thing as work-life balance. And I think everybody keeps talking about it like it's something they can strive for. I have three kids. I had my first one while I was doing full-time work, part-time school, for doing my master's degree at UNC as well. And and was a new mom, right? And the reality is that having 3 kids, I've gone through seasons where maybe I wasn't at my most productive or my most capable. And giving yourself and having the people around me who supported me at UNC Health to give me the grace to work through those seasons is what I've benefited from, and what I've truly enjoyed. And I think finding the right organizations that help you through the seasons of life, is probably a big factor in success as well.
Yeah. So finally, obviously, I guess I'm in high school now, and then for teens in general, like high school undergrad students, currently looking for work. Like in the summer, for example, there's not much to do, and it's like you could obviously waste time doing something else, but then there's also like valuable experiences that anybody could find. So, what do you think in finding those experiences, like, is the best piece of advice that you could offer high school and undergrads?
Yeah, yeah. So I really do enjoy engaging with different programs for youth that are looking to get into STEM careers and explore that. So I recently did with Amelia Mink. I was on her data science K through 12 all day summit that they had. This was just the last month, right? So supporting those kind of opportunities is a great way to remind all the kids in my life that there are things you can do as even in K through 12 to learn and engage and hear from other leaders as well as people that are performing those roles, within their careers every day. So I think taking advantage of some of the all day events that are happening, I think that's their summer summit. There's also really great programs for youth out there in STEAM programs through the universities, as well as, my sister, for example, runs a program, or is not run. She's on the board for a program that does this for girls, to make sure that they can get into STEM careers. So, I think there's lots of great opportunities. I'd advise any high school student to engage with, to understand and learn from folks. But I'd also say that, look for the internships. I know high school might be a hard time to find the internships, but especially after you get into college, there are some great ones. UNC Health even does internships for college students. And we do that because it's important to bring up that next generation into the workplace and see how they fit into these kind of roles.
Well, I think that's about it for today. Thank you so much for joining me here. And for anyone watching this, make sure to leave a like and subscribe.
Thanks, Ishan.
Thank you.